Hello. So I'd like to introduce Raúl Hernández with us today, and he is a community partnership coordinator for the project with the City College of New York and Memorial Sloan Kettering Cancer Center. And what this program does is providing access to cancer services and trying to reach diverse and underserved populations in New York City. And I think it's perfect for us to work with you and your program, Raúl, because we work in your Migrant Hub project. We work with women asylum seekers from many different countries, including a lot of people from Venezuela, from Northern Triangle countries, and West African countries, and we have people from Russia. So we have a lot of diversity in our group of different women we work with in different communities. We reach out with health information. So the floor is yours.
Thank you so much, Tanzilia. It's a pleasure being here. I know you invited us earlier this week to give a small presentation on healthy living. And today we're going to talk a little bit about breast cancer screening awareness. As you said, my name is Raúl. I am a community outreach coordinator, health educator, and research coordinator for the CCNY-MSK partnership. It's a partnership for cancer research. So we do research in cancer disparities. We also train researchers, underrepresented researchers in cancer research. And we also do community outreach. So as you said, we work with different populations. We work with, at the moment, we're working with the Nigerian community on a cancer screening project. We're working with the Latino community and the different consulates here in New York City to promote screenings. And now we're here with you guys. And so we're very excited to be working together and in tandem to do a little introduction to breast cancer screening and why it's important. I am a health educator by training. I trained for 10 years in the Bronx. So I've worked with families, young children, teenagers in high schools and adults. And I've focused a lot on preventing chronic disease. But recently I've been working a lot on cancer, and our goal really is to reduce the disparities in cancer, right? Especially in our communities, immigrant communities, communities of color. And so that's why it's so important to talk about screening, which is our first step really in saving lives, because it finds cancer or anything that's abnormal at an early stage before it really becomes anything that's too late and it's harder to treat. And just a caveat, obviously, I'm not a doctor. I do know a little bit, but I don't have all the answers when it comes to cancer or breast cancer. So if I don't know something, I will gladly ask our doctors, our PIs, our co-leads, who are physicians and who advise us on these projects. So feel free to ask your questions in the chat or to unmute, and I'd be happy to answer. And if I don't know, I'd be happy to get back to you afterwards. Obviously, to ask a question, you can put it in the chat, or you can also unmute with these two buttons. And if you'd like to raise your hand, feel free. If you want to clap, give a thumbs up, laugh, cry, feel free to do that too. Great. All right. So I work for the outreach core of the partnership, and we're going to talk a little bit about breast cancer screening. So what is breast cancer? So first we have to start with the big C, right? So what is cancer? Cancer is really a disease in which cells, which are found everywhere in our body, just divide without control, right? So there's no real control in the way they divide. Obviously, our cells have to divide, like the cells that are on our skin, right, on our hair, on our nails. They divide every day, they multiply. But in cancer, these cells divide uncontrollably, right? There's no regulation there. And that's because something has gone wrong in those specific cells where they just are growing out of control, okay? And breast cancer is basically cancer that's found anywhere in the breast. So it can be a tumor in the lobule, in the ducts. It can be in different parts of the breast, but when it's found in the breast, it's called breast cancer. Breast cancer cells usually form a tumor. So in this picture, you can see a tumor that has grown here. And this one is a malignant tumor. So a malignant tumor is a tumor that is not a good one, right? It's not one that we necessarily want to have. And it's something that needs to be treated, right? Because it can turn into something worse. But we also have tumors that are benign, right? And those are much, much more common. And so those benign tumors are usually found on mammograms, and those are very, very common. And there's usually nothing wrong with those, but those are commonly found on mammograms. But we also need to remember that although breast cancer happens almost entirely in women, men can also get breast cancer too. And that's about a 1 in 833 chance, which isn't, super high, but it's still a possibility, right? And that's because many people don't realize that men also have tissue in their breast that can develop into breast cancer. Men's breast tissue does have ducts and a couple or a few lobules, and so they can also get breast cancer. And that's important when we think about family history, right? When we think about family history and, passing down perhaps breast cancer through the lineage. And who needs to know? But we know that breast cancer is curable if it's found early, right? And so detection is so important, right? So getting screened at a regular time interval, early and regularly, is really a great way to find something early and cure it if it's there. And as I said, most breast lumps are benign and not cancerous. Yeah. All right. So now we're going to talk a little bit about risk factors for breast cancer. And in this first slide, we're going to talk about risk factors that cannot be changed, right? Unfortunately, time just keeps on moving. As we know in New York City, time for some reason in New York City moves a lot faster. I don't know why, but it does, right? And so age is one of those things that as you get older, right, cancer becomes, you're more likely to get something like cancer and breast cancer. Okay, so as you grow older, you're more likely to get cancer. Having relatives with breast cancer, so if you have a mother, a sister, or a daughter who has had breast cancer, your chances of getting breast cancer are also much higher, right? So it's important to know those family histories. And I know some people may not know a lot about their family. They may not know about their past. And so it's important to, even if you don't know, right, to still get screened at an age, and usually around 40 years of age. If you've had cancer before, whether that's in a different part of the body, or if you've had breast cancer before, you're also more likely to get breast cancer, right? Whether that's in the same breast or in a different breast, right? So breast cancer can happen again if you've already been diagnosed with cancer before. If you have dense breasts, you're also more likely to have a higher risk of having cancer. And dense breast really talks about the tissue that's found inside the breast, right? So this is connective tissue, and that connective tissue is a little bit, as we can say, thicker. And so on the mammogram, it's much harder to see through that tissue, which makes it even more difficult to find breast cancer. But usually, once you take that first mammogram, the doctor can tell you if you have dense breasts. When you get that result in the mail from the mammogram, it'll say whether or not you have dense breasts. And if you do have dense breasts, then that puts you at a higher risk of having breast cancer. If you've had your first period before the age of 12, you're also at higher risk of developing breast cancer. And that's because that means that this person has had more menstrual cycles in their life, right? That also means that the estrogen and progesterone, which are linked to breast cancer, have been in and running inside that person for a much longer period of time, which makes them increase their risk for breast cancer, right? Genetic mutations, for example, like the BRCA1 and the BRCA2, which are two genes that control for cell division. So if these genes are not functioning correctly, cell division is uncontrolled, right? And you are more likely to get breast cancer. And BRCA1 and BRCA2 are usually passed down from generation to generation, right? So if you are, we'll talk a little bit more about this, but if you are in, for example, in a family and you know that your mother has had breast cancer, your grandmother has had breast cancer, your aunt has had breast cancer, I would talk to your doctor and say, hey, I think I have a family history of breast cancer. And then ask your doctor if it's possible to do some sort of genetic screen, right? So that means taking a test to determine whether there is a gene like the BRCA1 or the BRCA2 that is being passed down from generation to generation. Because if there is, and you do find that out, you're actually able to treat it before you even have something like breast cancer. So women are able to take medication, take some sort of treatment, get surgery if they want to prevent them from having cancer if their risk is higher based on this gene. And if you're a woman who has had their menopause after 55 years of age, that also increases your risk of breast cancer. And that's actually related to, again, to menstrual cycles and the number of menstrual cycles in a woman's life. And so the more amount of estrogen and progesterone in a woman's lifetime, the more likely they are to have breast cancer. And so that also can affect breast cancer risk. Okay. And lastly, something that's not here, but there was a drug that was used in the 1940s to the early 1970s called diethyl stilbestrol, sometimes known as DES. And this was given to some pregnant women. It was given as an estrogen-like drug because it was thought to lower their chances of losing a baby or having a miscarriage. And so if these women took diethyl stilbestrol during that time period, they're more likely to develop breast cancer. And women whose mothers took DES, right, this particular drug during pregnancy may also have a higher risk of breast cancer. So that's important to know too, right? It's DES or diethyl stilbestrol. Okay, so we're going to move on, right, and talk a little bit more about what you can actually do, right? And I know a lot of you are probably already doing this in your own lives and talking to other people. I know you all are leaders in your community and are, talking to other folks about how to prevent cancer. And so to lower your risk of getting cancer, it's important to do all of these things, right? So limiting your alcohol use, right? For women, it's approximately 1 to 2 drinks a night. So drinking in moderation. So the more amount of alcohol that you do drink, the more likely you are to develop breast cancer. And that's because ethanol, the chemical found, the alcohol found in liquor, wine, champagne, you name it, right? That actually damages the cell and that can actually harm the way it divides. So it can actually lead to breast cancer. And the more you drink, the more likely you are to develop breast cancer. Even one drink can contribute to your risk. And when we talk about eating and drinking, we also think about being at a healthy weight, right? And that also means reducing your weight, making sure you're eating healthy, right? Eating the rainbow, eating lots of vegetables, fiber, fruits and vegetables, right? To make sure that you're at a healthy weight and being physically active, right? So making sure that you're exercising about 30 minutes every single day or an hour every other day. And we want to make sure that we're raising our heart rate, right? So make sure we're walking briskly, moving, exercising, because that is very, very important to reducing our risk of breast cancer, right? There's evidence, there's research that shows that regular physical activity reduces breast cancer risk, especially in women past menopause, right? Very, very important. Okay, women who have not had children or who had their first child after age 30 have a slightly higher breast cancer risk overall. And I know we're talking about modifiable risk factors, and sometimes this is not something that you can control. So this is something that I'm sometimes a little bit uncomfortable saying, right? Because I wouldn't always say that having children or when you have children is necessarily controllable. But it's important to know that women who have not had children or who had their first child after age 30 do have a slightly higher breast cancer risk overall. Okay. And we know that breastfeeding, for example, we know that breastfeeding may slightly lower your breast cancer risk, right? Especially if it's continued for a year or more. So if you're breastfeeding, if you're a parent or you're breastfeeding for a year or more, your risk of having cancer, right, breast cancer is actually reduced. So I know many folks are now promoting breastfeeding. I think it's an excellent way, if you're able to feed a baby. And so definitely another added benefit is to reduce your risk of having cancer. And lastly, certain hormones have been shown to increase the risk of having cancer, right? And so we know that, for example, birth control pills can raise your risk of developing breast cancer very slightly, but the risk disappears at about 10 years after you stop taking them. So if you took birth control from the time you were 20 until the time you were, let's say, 25, that risk is decreased by the time you hit 35. So by the time you're 35, that initial risk of having breast cancer is now decreased again. Okay, so very, very important. And again, I know we're talking about breast cancer, but many of these things, right? Like being overweight, like weight, healthy eating, staying physically active, also affects your risk for other diseases, especially for women, like heart disease, right? Diabetes, high cholesterol. And so doing a couple of these things, which you're already probably doing, does many, many other wonderful things for your life as well. And so it's important to continue doing those things. Family history, we talked a little bit about it, but we know that a significant number of women with breast cancer have some family history. We know that about 5 to about 10% of all cases of breast cancer are due to hereditary risk, meaning they result directly from mutations, right, that are passed down from one parent to their children, right? And so you may be about 2 to 3 times more likely than the average woman to develop breast cancer if a first-degree relative. That means that if your mother, your sister, or daughter has had the disease, and you are 2 or 3 times more likely to have that, to have breast cancer. Women with a father or a brother who has had breast cancer also has a higher risk of breast cancer. But we know it's always hard to find out the family history, right? We always talk about, other history. We talk about, how the party was last weekend or last year, or the wedding, we talk about our wedding memories. But sometimes it's hard to talk about these difficult topics, right? And so I highly advise and recommend that you find a private time to talk to your parents, talk to your family members, to understand this history of health in your family, whether that's for cancer, whether that's for diabetes, high blood pressure. It's important to know this so that you can talk to your doctor about your family history, and they can know your own personal risk and take different steps, right, to address it. And like I said, if you know that it's inherited, they can test for different genes to see if something is off, to give you treatment, or to even get you started screening at an earlier age so they can detect anything before it turns into anything worse. It's very, very important. Okay. But how does someone know if they have breast cancer, right? And I know the most common symptom that folks probably know is probably the lumps, right? And so having a lump is definitely one of the first initial signs that you have that something is a little off, right? But there are other ways that you can also know and tell if there might be breast cancer, and that includes nipple discharge. So if there's bleeding or blood that's coming out of the nipple, that's definitely a concerning sign, and you should immediately go to the doctor for that, right? If there's any dimpling, for example, lots of us have heard the term orange peel. So when you look at an orange, right, and the peel, when you look at it up close, it has little dimples or little holes in it, right, all around it. And so that's what we call dimpling, right? So if you see dimpling on the breast, that is a sign that could be indicative of breast cancer. You should immediately go to your doctor, right? If you have breast or nipple pain, you can also go to your doctor. That could be a sign of breast cancer. I know there are other signs too. I know, especially when women were taking the COVID vaccine this year, right? In the last year, a lot of women were reporting pain under their axillae or their underarm, right? Or near their breasts or the sides of their chest. And that was very common. And so a lot of women, I think, had a little bit of nervousness or anxiety related to that pain. But we know it's always important, if you do have any pain, to talk to your doctor about it. But I do know that some women who took the vaccine and had that pain, it was related to the vaccine. But if you're not sure, I highly recommend that you go to your doctor. If you don't have a doctor, again, I'll probably say this many, many times, but you're welcome to talk to us. We can help you find a doctor and get insurance if you need it. Okay, nipple retraction or inversion. So if the nipple, for example, is not protruding, but if it's actually a little less than flat, so if it's coming into the breast, that can be another sign, right? If you see any redness on the breast or changes to the skin of the breast, that can be a sign, or any changes to the lymph nodes. So sometimes you feel any lymph nodes, usually on the underarm or on the breast, which are these kind of tough little nodules. Sometimes you feel them. And if you're sick, sometimes you can feel your lymph nodes are a little inflamed. So you have lymph nodes all over your body, and some of them are on the breast. And if you noticed any lymph nodes on the breast that have changed, right, or have gotten a little bigger or a little thicker, that can be a sign of something like breast cancer. And if you feel swelling, of course, that is not normal and should be, you should talk to your doctor about that as well. Sometimes breast cancer can spread under the arm or around the collarbone and cause swelling there, even before the tumor in the breast is large enough to be felt. So if you have any pain that's strange, that's under the arm or around your collarbone, please go to your doctor and and ask those questions. Some of these symptoms can also be caused by other things that are not breast cancer. So if you have them, please report it to your doctor so they can actually find the cause of these symptoms. Again, many women may not have symptoms at all, which is happens when the cancer is at an early stage. And that is the best time to actually get a mammogram and to get a screening done, because it means it's not so big and hasn't gotten to the later stages, which are harder to treat. One thing that women can do, and men too, is to examine their breast and to be able to detect it on their own at home. Many recommend to do it about once a month to be able to detect any irregularities, lumps, dimples, changes in the breast. Obviously, it's important to become familiar with your body, with your breasts, to be able to recognize any unusual changes in the future. And if you feel anything that's off, please talk to your doctor, or feel free to call our number so we can connect you to a doctor. Okay, so the actual point of our program today, right, is the screening, right? The screening for breast cancer, and which is very, very important. So the goal of screening is really to find cancer before it causes any symptoms, right? And a screening is a test or an exam that is used to find a disease in people without symptoms, right? Therefore, having breast exams on a regular basis can help detect breast cancer at its earliest, most treatable stage, which is very, very, very important. The screening that we use here in the United States is the mammogram. That's the one that we most commonly use. I know we had a question in our last chat about screening tests. I know in other countries it may be a little different. Some doctors recommend doing an ultrasound first in other countries, but here in the States, we usually start off with the mammogram. That's the most common screening test that is used. And then follow-up screenings may involve ultrasounds to be able to look in more detail, or even MRIs. But breast cancer is most easily treated and more likely to be cured when it is found early, which is why it's so important to do these screenings, right? A screening can actually save your life. Very, very important. Wonderful. So what is a mammogram? So a mammogram looks exactly like this, right? So it's a bit of a large machine that is usually found at a breast center or an imaging center, right? And so what it does, it takes low dose X-rays, right, of the breast. And so it takes a couple of pictures. As you can see, this is a picture of a breast that has been developed. And over here, you see a white, very dense piece of tissue, which is labeled as cancer. And that's how doctors can tell if there are some abnormalities in the tissue. And really, taking these mammograms and doing them regularly is really important, because you can see changes in the breast over time. And so keeping a record of those X-rays is very, very important, because doctors can compare what the breast tissue looked like last year and the year before that to see if there's any differences, right? So it's kind of like if you're going to the gym, right, and you take pictures in front of the mirror and you're saying, hey, okay, today, you flex, and you turn to the mirror and you know exactly what you look like on this day, and then a month later, you know how your body has changed. It's a similar way, right, to be able to tell those differences by the doctor. Okay. We know that studies have shown that regular annual mammography screening for women with no symptoms of breast cancer has lowered the number of women who die from the disease by about 30%. And that's really important, right? That's really, really important, because for us, it's about decreasing the deaths, right? We may not be able to reduce the amount of cancer in the world, right? We know that breast cancer in general just doesn't stop. But we know that we can help survival. We can help women survive if we catch these cancers at an early age. And so we know that mammography can reduce death by this disease by about 30% if it's done annually. So when should most women get screened? So most women who are average risk, right? So average risk really means that they don't have any symptoms of breast cancer. They don't have any first-degree relatives, like a parent, a sibling, or a child with breast cancer. No one in your family has ever had breast cancer or ovarian cancer. Then you would qualify as someone of average risk. If that's you, then the recommendation by Memorial Sloan Kettering is to have a yearly clinical breast exam between the ages of 25 and 40. And that's really an exam that's done by a clinician, by a doctor or a healthcare provider, to be able to palpate and feel the breast for any abnormalities, okay? That's an option. Some women don't do that at all. But once you turn 40, right, you should be getting a mammogram done. And usually mammograms are done about every year, but it depends on your doctor's recommendation. Some will go back every 6 months, or some will go a little bit more than that. And so it really depends on your risk for cancer and what they see on the X-ray, okay? If you are above average risk, right, that means that you have a parent, a sibling, or a child with breast cancer, or if you have a genetic mutation like the BRCA1 or the BRCA2 gene, right, which increase your risk of having breast cancer. And so that means if you have any of these, then you are considered above average risk. So mammograms and breast exams should start no later than 10 years before the age of the earliest diagnosis of your affected family member. What does that mean? It might be a little bit confusing, but that means if your mother was, for example, 45 when she had breast cancer, you should not start any later than 10 years before that. So you should really start at 35 years of age, if not earlier, right? So if you, for example, if your mom had breast cancer when she was 40, then you should start minimum at age 30 to start getting your screening done, because we know that earlier diagnosis can mean saving your life, okay? And women should not get a mammogram earlier than age 25, and definitely not later than age 40, okay? And how often you get that screening done depends on your doctor's recommendation, okay? We're finishing up our talk, but how much does breast cancer screening cost? I know the medical system in the US is very confusing. There's so many different insurance plans and everything costs a ton of money. But here in New York State and in most of the United States, there are free programs for women to get screened. We have a connection with our Ralph Lauren Center, a Memorial Sloan Kettering Cancer Center in Harlem, which provides free breast screenings for women. Okay, they provide mammograms for free. So that means if you don't have insurance, if you do have insurance, if you don't, if you have If you're undocumented or if your insurance does not cover it, you are safe with us. You can make an appointment with us for free for a free mammogram, okay? We are happy to do it for you. And if English is not your preferred language, we also have translators who we can get to help translate during the visit as well. And if you do have insurance or are worried about whether your insurance covers the cost of screening, you can talk to us as well about that. Remember, don't wait. Discuss breast cancer screening with your doctor as soon as possible. Remember that women with a parent, a sibling, or a child with breast cancer are at higher risk of developing breast cancer. Know your breast, know your body, talk to your doctor immediately if you notice any changes in how they feel or how they look. We know that breast cancer is curable if it's found early. So please get screened for breast cancer. It can save your life. We're here to help. We offer cancer screenings, medical care, help with health insurance, health education. This is our phone number if you want to take a picture of that. This is our email address as well for our outreach team. This is the team, the Immigrant Health and Cancer Disparity Service at MSK. We also partner with them, and they have asked me to give a little message about health insurance during today's talk. So I'm going to talk a little bit now about accessing healthcare here in New York. So different options for health insurance and health access programs. In New York State, we are very lucky because we have insurance programs that are available on the marketplace. So this is what we were used to call Obamacare. And our teams here at the Immigrant Health and Cancer Disparity Service can help you see if you qualify for insurance, whether that's Medicaid, whether that's an essential plan, whether that's Child Health Plus insurance for your kids and your family. We can help you not only see if you qualify, but sign up for a plan that you choose and that you want, right? We also have New York City Care here in New York City, which is a healthcare access program that guarantees low cost and even free services, preventative services by the New York City Health and Hospitals, okay? So to be eligible for the Obamacare or the New York State marketplace, you must be living in New York State. You must be a US citizen, national, or lawfully present immigrant. Different immigration rules may apply if you're eligible for Child Health Plus or New York State Medicaid or the essential plan based on your income, and you must be under 65 years old. If you don't qualify for the marketplace, or if you're undocumented, you can apply for New York City Care. It's a health plan here in New York City, and we're very lucky. It's new. Many of you may have heard of it. It's an incredible program that's offered here in New York City through the Health and Hospitals Corporation. There are many of those throughout. In the Bronx, we have many, Lincoln Hospital, North Central Bronx and Manhattan. We have Metropolitan, Harlem Hospital. In Queens, we have Elmhurst. In Brooklyn, we have Jamaica, Coney Islands. So there are tons all over the 5 boroughs. And this is a really wonderful program that you can sign up for. Many of the plans are actually free, so you don't have to pay a single thing to go to the doctor. So they also help you with that. We can also help you with that. So if you want more information, you can contact Chanel Martinez at her email or phone number. We also speak English, Spanish, Arabic, French, Mandarin, Cantonese, and Bengali. Or you can contact me as well, and I can connect you with them as well. Thank you so much. It's a privilege just being able to talk about breast cancer screening today with you all. And yeah, I'm open for questions.
Yes, anyone can type questions in chat also, but also go on screen and ask any question. Okay, maybe Dana, you want to say a couple of words?
Can I ask a question?
Yes, of course.
Yeah, my name is Neka. Sorry, my camera is not on. You mentioned giving birth after 30. Can't the fact that you breastfeed for more than a year cover up for giving birth after 30 by reducing the risk of you having cancer?
Yes, that's a great question. I think it's hard to calculate exactly what the percentages of risk are. And so, everything you can do to make sure that you're lowering your risk. So that definitely includes breastfeeding. So if you breastfed for more than a year, we know that that'll definitely reduce your risk of having cancer. I don't know the exact, calculation. I don't think it's very hard to calculate that, but I would definitely recommend doing, continuing what you're doing, whether that's breastfeeding, whether that's eating healthy, whether that's exercising, all of that can help reduce your risk of cancer. And so if you're concerned about any sort of, risk factors that sometimes you can't really change, right? Whether that's your age or whether that's, when you had kids, just, doing anything that you can do on your end to reduce your risk will go a long way. And, I really, that's, it is a risk factor. I don't really like, saying it sometimes or talking about it in that way because, it's not really an option that some women have. I know, and thinking about my own family, right. And thinking about my partner and my wife and children. And so it's, we were both, in our 30s, in our mid 30s. And so it's an age when, it's just when we're deciding to have kids and unfortunately there's nothing we can really do about it except, really take care of our own bodies. Whether that's reducing the amount of alcohol we drink or anything else, that'll definitely help, Ms. Neka.
Thank you.
I have a question. Hi, can I say something? Hello.
Hi, welcome. Yes, of course.
Thanks. Last time I did ask a question and by mistake I typed it. My question was, many people say that usually they say that if you're breastfeeding 100%, you have a chance to not get cancer, breast cancer. But I know someone who breastfed 8 kids, but right now she's on the final phase for breast cancer. Can you a little bit explain why? For my understanding, breast cancer was like through family. Let's say if your dad, your mom, or anyone of your family have a breast cancer, mostly not 10% someone from the kids will have a breast cancer. So, and also on the other hand, since I was little, it said that, if you become a woman and you have kids, breastfeed them. If you breastfeed them, you would never get a cancer. How can we explain this woman who breastfed 8 kids during her life? She never used formula, but now she have a breast cancer and she's on the last stage.
Yeah, thank you. Thank you for your question and for sharing that experience. And, breasts, it's when you're doing everything for your kids, right? Breastfeeding and taking care of such a beautiful family. It's heartbreaking to hear something like that. And so, thank you for sharing. It's always hard. Breast cancer is very complicated. There is not one thing that will 100% prevent you from having cancer, nor one thing that will 100% make you get cancer. And so I think that is one thing that I would like to clear up, right? Which is a misconception that breastfeeding will 100% prevent you from having breast cancer, because that is not true. We know that it lowers your risk, but it doesn't mean that it'll prevent you 100% from having breast cancer. And there really isn't anything that'll prevent you from having breast cancer. But I don't want you to be afraid, right? That's not the point of today. The point of today is really to make sure that we don't get to a stage where we're finding cancer at a late stage. And that is the problem. That is what is making our communities, die at a faster rate than other communities, right? So when we look at the statistics, we know that Black women, right, die at a higher rate than white women here in the US of breast cancer.
Yes.
And that is not right, because white women are actually diagnosed more often with breast cancer than Black women. But the problem is that the diagnosis comes at a later stage, right? And so we need to make sure that we're being screened, right, at an earlier age so that we can save these lives. And so screening regularly and early, starting by the age of 40. And if there's a family history, even earlier, right, to make sure that if there is anything that's there, that it's at an early stage, it can be cured, right? And when you say that, tell me the story of that woman, right? That mother who's in the final stage, that is too late, and that is heartbreaking, and that is not something that anybody should have to go through. And so, please, if there's anything you remember from today, it is that screening saves lives, and that goes for breast cancer, that goes for colorectal cancer screening, that goes for cervical cancer screening, that goes for prostate cancer screening as well. And so screenings are really a great way to save a life. And so I hope that answers some of your question.
Yes, you did. And I'm happy that to hear that you say that screening is very important, because for me, if we have like you said, like most of the black community, they don't take that cancer seriously. First of all, they don't, like, sometimes you have a little pain on your breast, you're just gonna neglect, like you're just gonna say, oh, this is a regular pain, and it keep happening. So instead them going to see a doctor, they're just gonna take it as a joke, as something easy. So at the time they find out, it's too late, like this woman's situation. And I think that we can, like, I think the best thing you guys are doing is good, like do more workshop, like have like even what's calling advertisement, like advertisement for a lot of people who are infected right now. It can open their mind to know how sad and how I don't know how to explain how a breast cancer can suffer. Somebody who have the breast cancer can suffer into the end of the life. In one word, like you say, screaming is very important for most of us as a female, to take it to ourselves, yourself first, than others. I don't know if you understand what I'm trying to explain.
Yes, of course. So 100%, as an outreach coordinator, that's exactly my mission. And so you are doing, you yourself, I can hear it in you. There's also a passion there of being an advocate and being in the community. And I hope you take this message as well, and also promote it with your family, with friends. And, that is the goal of today too, right? It's for everyone to learn. I always learn something new. And so I hope there's something here that you can take away, so that you can be that leader in your community as well. And that will be a blessing. Absolutely. So
yes, I will. Thanks for your time. Thanks for everything.
Yes, I think, Marty, exactly. And Raúl, you mentioned that we want you, like the women who were a small group today, you represent your communities. I mean, you are leaders and future leaders, and we rely on you to bring this information to various communities and to reach out, because people trust you, right? It's one thing that to provide a webinar or official information. Another thing, when you talk to your community as a friend, as a neighbor, about these things, and convince them that it's very important to do the screenings on time, even if you're a younger woman. It's when you don't have symptoms, it's something you have to do regularly, right? And what Raúl just mentioned. If there are no more questions, again, I want to thank.
Sorry, I have one question, Cecilia.
Yeah,
Sorry.
Deborah. Yes.
Hi, Raúl. So you were talking about the screening. I have been in the US for 3 years and a half, and I haven't been able to do a screening because they have told me that I need to be, then I need to have something in my breast, or I need to feel something. So in that case, what I should do, because I come from a country that we regularly do our screening every year, and I haven't been able to do it here in the US.
Yes, that's a great question. And that's something that was brought up, Deborah, last class similarly, in the sense that, um, the way, the recommendations, right, for breast cancer screening are different from country to country, right? So here in the US, there's a governing board of doctors and researchers that make guidelines, right? And they advise, practitioners to start screening at the age of 40. And they usually do that because there is enough evidence to show that starting at age 40 is when there is actual possibility of breast cancer. And so they know that if they start any earlier, I know there was a slide there that I put up that said if you start before, they don't recommend anyone do it before age of 25, but really most women won't get the chance to do it here in the US before the age of 40 unless there are any symptoms, unless there's a family history. And that's because the research has shown that screening before the age of 40 actually causes more harm than good, which actually sounds a little bit, it's a little crazy, right? Because you think, we think, oh, like I would want to do a screening to find out, if I have something there. But when they've done the studies, when they show that most of those screenings that happen under age 40, one, don't show any cancer, and two, cause more anxiety than anything else, then that's when they start recommending screening at age 40. But Deborah, if there are any symptoms, if there's any family history in your family, then that's something that would qualify you for getting a screening at an earlier age, such as a mammogram. But like I said as well, if you're interested in getting a screening, you can also get a clinical breast exam, which is something that you can request from either your doctor or your OBGYN. And let me go back to that slide very quickly. And so we recommend here at MSK a clinical breast exam starting at age 25. It's not a mammogram, but it is an exam that's done yearly by a trained professional, right? And so they can palpate and see if there's anything that's off or abnormal with the breast. I hope that helps.
Yeah, and what about the ultrasound?
Yes, so usually the ultrasound is not the first line of screening in the US. The mammogram is the most commonly used. Usually the ultrasound comes in after they've done the mammogram. And so a mammogram will show, like I said in the picture over here, it'll show like a white circle. But the ultrasound will then be used as a follow-up screening to be able to actually see it a little bit more in detail. And if they need even more detail, to go and use the MRI. But it's usually the mammogram that's mostly used here in the US.
Okay, thank you.
Thank you.
Any more questions?
I'm going to leave my information here, Tanzilia, if anybody wants to take it. This is our phone number, our email, and I know many of you registered today, so we'll get in touch if you need more information related to our programs, and spread the word. Feel free to come by for a mammogram or a cervical cancer screening or anything else, colorectal cancer screening. Let us know how we did, and then if you liked it, recommend it. Then we're happy to also hear your feedback. So thank you very much.
Thank you, Raúl. Yes, Memorial Sloan Kettering Hospital is one of the biggest, well-known in New York City. It's one of the biggest research centers on cancer. And there are a lot of programs. I know that you can get free care and free cancer care. And as Cynthia says in the chat, it's very important. Maybe you will not prevent and stop cancer, but it's very important to find it early so you can be treated fully. So that's the most important, and to pay attention. Again, Raúl, thank you for your time. This is great. We'll be posting the recording of this event on our website, and we'll promote this further, and we'll have your contact information now, so everybody in this group can use this in their communities. And we have also a poster you sent along this presentation that we'll be posting and circulating in communities. And we know you have language access. Thank you so much.
Thank you. Thank you so much. It's a privilege being able to talk about this topic here with you all. So thank you very much.